Welcome to The Explainer. Today, you're going to be the detective. We've got two common but really different breast health mysteries to solve. We're going to look at all the clues, follow the evidence, and crack the case, turning some pretty complex medical puzzles into answers that actually make sense.
Okay, so let's jump right in. We've got two totally different scenarios to investigate. And our first case? Well, it starts with something that, let's be honest, causes a ton of anxiety for a lot of people. And that's finding a lump.
So let's meet patient number 1. She's a 35-year-old woman, and about 2 months ago, she found a painless lump in her breast. This is where our investigation officially kicks off.
All right, so here are the first clues we get from the physical exam. The lump feels firm, but, and this is a big one, it's mobile. That just means it moves around pretty easily under the skin. It's not stuck in one place. It's also not tender at all. You know, what's just as important here is what the doctor doesn't find. There are no skin changes, no discharge, and no family history of breast cancer. Seriously, every single one of these details is a critical piece of the puzzle.
Okay, next up, we bring in the technology to get a much closer look. So the mammogram and the ultrasound, they both show a mass that's well-defined and uniform, which, by the way, are both really good signs. But the real game changer, the definitive clue, comes from something called a fine needle aspiration. It sounds complicated, but it's really just taking a tiny sample of cells. And the results couldn't be clearer. They're totally benign, just normal breast cells.
So, let's recap. We have a painless, mobile lump, we've got clear imaging, and we have a benign cell sample. With all that evidence on the table, what do you think is the most likely diagnosis here? Come on, let's put these pieces together. And the diagnosis is a fibroadenoma. If you guessed that, you are absolutely right. This is actually the most common benign, that means non-cancerous, breast tumor found in young women. And it just perfectly fits every single clue from our patient. And this chart really shows you why it's a fibroadenoma. It's a classic case of diagnosis by elimination, right? The features just line up perfectly. We know it's not a cyst because cysts are fluid-filled and this lump was firm. It doesn't act like a carcinoma, which is usually stuck in place and has irregular borders. And since there was no trauma or injury, we can rule out fat necrosis. And just like that, case number 1 is solved. All right, on to mystery number 2. And this one is a whole different ballgame. See, this case doesn't start with a symptom the patient can see or feel. Nope. It all begins with a routine screening test, which is a perfect example of why these screenings are just so incredibly important. So our second patient is a 50-year-old woman, and she feels completely healthy. No symptoms, no lump, nothing. The only clue, our hidden clue, comes from her routine mammogram. It shows a small cluster of what are called microcalcifications. The easiest way to think of these is like tiny little specks of calcium that pop up on the X-ray. Now, they're not always a problem, but sometimes they can be a sign that cells in that area are starting to change. And because those microcalcifications are a potential red flag, the doctors did the right next step, a core needle biopsy. And that test gave them a definitive diagnosis, ductal carcinoma in situ, or as it's more commonly known, DCIS. Okay, now I know that hearing the word carcinoma can be really scary, but it is absolutely crucial to understand what DCIS actually is. Think of it as stage 0 breast cancer. What that means is the abnormal cells are completely contained inside a milk duct. They haven't broken out or spread anywhere else. It's like they're still behind a wall. It is truly the earliest possible stage you can find this. So that brings us to the big question, right? When you catch something this early, before it's had a chance to become invasive, what's the best way to manage it? How do you make sure you get the best possible outcome? Well, the standard treatment plan is a really effective 2-step approach. First up is a lumpectomy. This is a type of surgery that just removes that small area with the abnormal cells, which means the breast itself is conserved. Then, that's followed up with radiation therapy. The whole point of the radiation is to clean up any stray abnormal cells that might be left behind and dramatically lower the risk of it ever coming back. You know, it's just as important to talk about what isn't needed in this case. Just watching and waiting? That's not enough, because DCIS can progress into invasive cancer. But on the flip side, a full mastectomy is usually way too aggressive for something found this early. And since the disease hasn't spread, it's non-invasive, chemotherapy isn't necessary either. It's all about tailoring the treatment to be just right for the stage of the disease.
Okay, so we've solved our 2 medical mysteries. They were pretty different, weren't they? So what are the big takeaways? What are the key lessons we should all remember from this? So, what did we really learn here today? I think there are two huge lessons. First, not all lumps are cancer, but, and this is a big but, every lump is a reason to get checked out by a doctor. And second, routine screening is basically your health superpower. It can find things, like DCIS, long before you could ever feel them, and that means you catch it at the earliest, most treatable stage. And that almost always means more manageable treatments and fantastic outcomes.
So, what was the single most important thing you learned about health screening today? You know, our whole goal here was to pull back the curtain on this stuff, to demystify the whole process. Because when you understand the why behind the tests and treatments, that fear of the unknown starts to shrink. And that's really the biggest takeaway of all. Knowledge is power. It empowers you to be a proactive partner in your own health. Thanks so much for being a health detective with me today.